think people just have become numb to, everyone has a story that they can share of what has happened. And I think that's wrong. It should be, we should be hearing 5 good stories and maybe 1 bad. And it seems to be the other way around now. And I think that's what we have to reverse. And today we are launching our research document entitled Pushed Out of Hospital, Abandoned at Home.
I'll just give you some examples from the people who called a hotline. I'm looking at a woman who called about her mother on page 33. Her mother was admitted for symptoms of a stroke, neglected in the ER, left for 3 hours. No one did any tests, etc. You know that intervention when you've had a stroke early is critical to retaining your motor functions, etc. So the mother was neglected, and then the hospital focused its efforts. She said then the hospital wanted her out. They were threatened with surcharges. Again, her mother was neglected in the care, developed pneumonia, and died. And the woman who called the hotline said, "My mother had 9 children and 27 grandchildren, and she didn't deserve that." No, she didn't.
The statistics are showing over the next few years, this community is going to have a 30% increase in the aging and elder population compared to the rest of Ontario. And they're going to have the highest 26% of all of Ontarians with heart, cardiovascular, stroke.
And yet the budgets are falling in real terms, and the beds aren't available, and there's more pressure to close more beds. We're saying, like, Ontario already has, only Mexico on the developed economies has more beds than Ontario does to patients. Like, go to Britain, go to France, go to Sweden, like the United States. Anybody else would have more beds than we do. We don't have enough beds to provide a place for your loved one when they have a stroke, when they, right? We just don't have the capacity. We're here today to do is to give voice to those people, many of them elderly, who've been neglected and ignored and abandoned by the healthcare system. And we're here to demand that Ontario take responsibility and take some steps to make sure that the individual tragedies that have occurred here that are actually part of a systemic narrative don't happen again.